The normal sodium level in the body is A. 135 to 145 milliequivalents. B. 3 to 5 milliequivalents. C. 135 to 145 microequivalents. D. 3 to 5 microequivalents. Guess the right answer. Right answer is A. 135 to 145 milliequivalents. Mucin falls under what functional category of the alimentary mucosa? A. Secretion. B. Absorption. C. Barrier. D. Immunologic protection. Guess the right answer. Right answer is A. Secretion. Which disease decreases the metabolic rate? A. Cancer. B. Hypothyroidism. C. Chronic obstructive pulmonary disease. D. Cardiac failure. Guess the right answer. Right answer is B. Hypothyroidism. Which of the following structural components of taste buds acts as stem cells for the other structural cells? A. Neuroepithelial cells. B. Supporting cells. C. Basal cells. D. None do. They are all replaced every 10 days. Guess the right answer. Right answer is C. Basal cells. The innermost layer of the heart is A. Epicardium. B. Endocardium. C. Myocardium. D. Pericardium. Guess the right answer. Right answer is B. Endocardium. Which of the following sphincters prevents colonic bacteria from entering the small intestine? A. Pharyngoesophageal sphincter. B. Pyloric sphincter. C. Ileocecal valve. D. Internal anal sphincter. Guess the right answer. Right answer is C. Ileocecal valve. Avulsed teeth should be placed in A. Normal saline. B. Cold water. C. Milk. D. Warm water. Guess the right answer. Right answer is C. Milk. Trypsin catalyzes the cleavage of dietary proteins and activates zymogens. It is formed from trypsinogen, which is secreted at what location? A. Stomach. B. Duodenum. C. Gallbladder. D. Pancreas. Guess the right answer. Right answer is C. Gallbladder. When caring for an infant during cardiac arrest, which pulse must be palpated to determine cardiac function? A. Carotid. B. Brachial. C. Pedal. D. Radial. Guess the right answer. Right answer is B. Brachial. Which type of cancer has the poorest prognosis? A. Squamous cell carcinoma. B. Breast cancer. C. Pancreatic cancer. D. Gastric cancer. Guess the right answer. Right answer is C. Pancreatic cancer. Which electrolyte is essential for enzyme and neurochemical activities? A. Chloride. B. Magnesium. C. Potassium. D. Phosphate. Guess the right answer. Right answer is B. Magnesium. How many bones make up a newborn's skull? A. 8. B. 4. C. 6. D. 5. Guess the right answer. Right answer is D. 5. Which of the following is an important nursing intervention for a patient with Cushing syndrome? A. Left middle cerebral artery. B. Observe for hypotension. C. Protect from infection. D. Restrict carbohydrate intake. Guess the right answer. Right answer is C. Protect from infection. Involvement of which of the following structures will lead to right-sided hemiplegia and aphasia? A. Left middle cerebral artery. B. Vertebral artery. C. Brain stem. D. Right middle cerebral artery. Guess the right answer. Right answer is A. Left middle cerebral artery. Which one of the following is a common response expected in a patient with stroke to the change in body image? A. Denial. B. Disassociation. C. Delusion. D. Depression. Guess the right answer. Right answer is C. Delusion. A positive over-the-counter pregnancy test is considered a possible sign of pregnancy. B. Presumptive sign of pregnancy. C. Probable sign of pregnancy. D. Positive sign of pregnancy. Guess the right answer. Right answer is C. Probable sign of pregnancy. Which of the following is intravascular fluid? A. Lymph. B. Pleural fluid. C. Plasma. D. Synovial fluid. Guess the right answer. Right answer is C. Plasma. Which of the following is an isotonic solution? A. Lactated ringes. B. Half normal saline. C. 1/3 normal saline. D. Mannitol. Guess the right answer. Right answer is A. Lactated ringes. Which of the following is a first-line drug used for pain management? A. Acetaminophen. B. Clonidine. C. Morphine. D. Ketamine. Guess the right answer. Right answer is A. Acetaminophen. Which of the following is the organism that causes peptic ulcer disease? A. Staphylococcus. B. Cornbacterium. C. Helicobacter pylori. D. Streptococcus. Guess the right answer. Right answer is C. Helicobacter pylori. Which of the following nutrients helps for tissue repair? A. Vitamin. B. Fat. C. Carbohydrate. D. Protein. Guess the right answer. Right answer is D. Protein. Which of the following patient activities helps to relax the external anal sphincter while administering enema? A. Separating the buttocks. B. Lubricating the catheter tip. C. Inserting the catheter slowly. D. Breathing out through the mouth. Guess the right answer. Right answer is D. Breathing out through the mouth. Which of the following is a vesicant drug? A. Dactinomycin. B. Morphine. C. Azithromycin. D. Bogarin. Guess the right answer. Right answer is A. Dactinomycin. Which of the following immunoglobulin are responsible for anaphylactic reactions? A. IgA. B. IgE. C. IgM. D. IgG. Guess the right answer. Right answer is B. IgE. Which of the following drugs will be administered to treat anaphylaxis? A. Atropine. B. Sodium bicarbonate. C. Digoxin. D. Epinephrine. Guess the right answer. Right answer is D. Epinephrine. Which of the following symptoms should be watched for in a patient receiving a loop diuretic? A. Restlessness and agitation. B. Paresthesias. C. Increased blood pressure. D. Weak irregular pulse. Guess the right answer. Right answer is D. Weak irregular pulse. Which of the following should be watched for in a patient who has just undergone a total thyroidectomy? A. Weight gain. B. Depressed reflexes. C. Positive Chvostek sign. D. Personality changes. Guess the right answer. Right answer is C. Positive Chvostek sign. Which of the following surgical procedures involves removal of a body organ? A. Tracheostomy. B. Laparotomy. C. Mammoplasty. D. Mastectomy. Guess the right answer. Right answer is D. Mastectomy. Which of the following is an earliest manifestation of inadequate oxygenation? A. Diaphoresis. B. Cyanosis. C. Restlessness. D. Hypotension. Guess the right answer. Right answer is C. Restlessness. Which of the following is an intervention for a patient with chronic obstructive pulmonary disease? A. Pursed lip breathing. B. Chronic steroid therapy. C. High flow oxygen. D. High carbohydrate diet. Guess the right answer. Right answer is A. Pursed lip breathing. Which of the following is a normal finding obtained during a lymph node palpation? A. Hard, fixed node. B. Firm, mobile node. C. Enlarged tender nodes. D. Hard, non-tender nodes. Guess the right answer. Right answer is B. Firm, mobile node. Which of the following conditions is caused by elevated intraocular pressure? A. Glaucoma. B. Cataract. C. Strabismus. D. Myopia. Guess the right answer. Right answer is A. Glaucoma. Which of the following is the most common pathologic finding in individuals at risk for sudden cardiac death? A. Aortic valve disease. B. Mitral valve disease. C. Left ventricular dysfunction. D. Atherosclerotic heart disease. Guess the right answer. Right answer is D. Atherosclerotic heart disease. Which of the following drugs provide relief of anxiety and decreases both preload and afterload? A. Amrinone. B. Morphine sulfate. C. Furosemide. D. Dobutamine. Guess the right answer. Right answer is B. Morphine sulfate. A client with emphysema is placed on diuretics. In order to avoid potassium depletion as a side effect of the drug therapy, which of the following foods should be included in his diet? A. Celery. B. Potatoes. C. Tomatoes. D. Liver. Guess the right answer. Right answer is B. Potatoes. In a client with chest trauma, the nurse needs to evaluate mediastinal position. This can best be done by A. Auscultating bilateral breath sounds. B. Palpating for presence of crepitus. C. Palpating for tracheal deviation. D. Auscultating heart sounds. Guess the right answer. Right answer is C. Palpating for tracheal deviation. When administering phenytoin, dilantin, to a child, the nurse should be aware that a toxic effect of phenytoin therapy is A. Stevens-Johnson syndrome. B. Folate deficiency. C. Leukopenic aplastic anemia. D. Granulocytosis and nephrosis. Guess the right answer. Right answer is A. Stevens-Johnson syndrome. As the nurse assesses a male adolescent with chlamydia, the nurse determines that a sign of chlamydia is A. Enlarged penis. B. Secondary lymphadenitis. C. Epididymitis. D. Hepatomegaly. Guess the right answer. Right answer is C. Epididymitis. The nurse would need to monitor the serum glucose levels of a client receiving which of the following medications owing to its effects on glycogenolysis and insulin release? A. Norepinephrine. B. Dobutamine. C. Propanolol. D. Epinephrine. Guess the right answer. Right answer is B. Epinephrine. To diagnose ectopic pregnancy, the best investigation is A. Laparoscopy. B. USG. C. Hysteroscopy. D. Urine pregnancy test. Guess the right answer. Right answer is B. USG. The most accurate oxygen delivery system is the A. Facial mask. B. Non-rebreather mask. C. Venturi mask. D. Nasal cannula. Guess the right answer. Right answer is C. Venturi mask. Which of the following is most commonest cause of liver cirrhosis is A. Caffeine. B. Analgesics. C. Infection. D. Alcohol. Guess the right answer. Right answer is B. Alcohol. Perception of any object in the absence of actual stimulus is termed as A. Illusion. B. Delusion. C. Hallucination. D. Dementia. Guess the right answer. Right answer is C. Hallucination. When assessing a client in the early stages of cirrhosis of liver, what sign would be anticipated? A. Ascites. B. Jaundice. C. Anorexia. D. Peripheral edema. Guess the right answer. Right answer is A. Ascites. Uncontrollable risk factor of CAD, coronary artery disease, is A. Heredity. B. Stress. C. Exercise. D. Obesity. Guess the right answer. Right answer is A. Heredity. The vaccine used for the prevention of cervical cancer is A. HPV. B. IgG. C. Hepatitis B. D. BCG. Guess the right answer. Right answer is A. HPV. The most serious complication of meningitis in young children is A. Blindness. B. Epilepsy. C. Hydrocephalus. D. Peripheral circulatory collapse. Guess the right answer. Right answer is B. Epilepsy. Pap smear test is used for screening of which of the following? A. Cervical cancer. B. Ovarian cancer. C. Liver cancer. D. Breast cancer. Guess the right answer. Right answer is A. Cervical cancer. The normal range of CVP is A. 5 to 15 cm H2O. B. 10 to 15 cm H2O. C. 10 to 20 cm H2O. D. 5 to 10 cm H2O. Guess the right answer. Right answer is D. 5 to 10 cm H2O. The extra calories needed by a woman having singleton pregnancy. A. 100 kilocalorie. B. 200 kilocalorie. C. 300 kilocalorie. D. 500 kilocalorie. Guess the right answer. Right answer is C. 300 kilocalorie.